Hey guys, thank you so much for tuning in to my video today. My name is Ruby Jones and I am your favorite dental diva. In today's video, I am going to cover 8 mistakes when it comes to our dental lab case management system. Okay, so if you are a dental assistant and you're wanting to grow your skills and your organization skills and just your tactics when it comes to dealing with the craziness of these different lab cases, you want to stay tuned to this video. Mistake number 1 is going to be not having one assistant assigned to the system. Okay, so it is so helpful to not have everybody's hands in this management system because the lines of communications get lost, it gets confusing, somebody drops the ball. Did you send the lab case out? Did you forget to check the lab case in? Is the case even here in the office? Big mistakes that can cost you your patience, your time, and of course, your money. All right. And so it is a great thing to have one assistant assigned to the entire lab case management system. Second mistake is going to be when you do not schedule your patients for their follow-up appointment. So as I mentioned in the last video, please go back and watch it. It is extremely important for you to schedule your patient for their seat appointment or for their delivery appointment or for their try-in appointment, whatever appointment they are coming back for to receive their case or again, to try it in, make sure you schedule it at that first visit. It is so easy to not schedule it. They fall off and never come back, or they will call the office upset asking why didn't they get a call to return back to the office for the thing that they ordered. So if you are just scheduling all of your follow-up appointments, you will avoid this mishap. Mistake number three is going to be when you do not use your software management system. So whatever system it is that you guys use at your office, it could be Dentrix, it could be Eaglesoft, Patterson Eaglesoft. It could be Dolphin. There is so many different software. So depending on the one that your office use, there is surely a lab case management record to keep what you are sending out, what lab you sent it to. You can even add in the tracking information. And so because we are clinical assistants, sometimes the labs will call and they have questions, right? And it is a headache for the front desk to come and pull us from the clinic. For them, it's a headache. They got to get up, walk down the hall, find us, pull us up front or ask us the question. And it is disrupting to us if we are in the middle of treatment. So if you are using your software management, they are easily able to pull up the patient's chart and information, tap into that the lab segment of the profile, and more than likely they can answer all of the questions that the lab has for them. Or if the patient calls in and the patient is asking, hey, you know, when are you expecting to receive my dentures, my partials, my Invisalign, whatever it is, the front desk, or even yourself, if you happen to be answering the phones, right, that day, you are able to click into their chart, into the lab case management section, and easily see when you sent it out, and probably even copy and paste the tracking information to get exactly when it's going to be delivered. Okay, and so avoid mistake number 3 by actually using your software management system. And I will say, because I was an assistant for nearly 15 years, it's been a minute, right? So when I started, we did not really have all of the technology and the capabilities really, or if we did, we definitely didn't use it. What I'm trying to say is we used a lot of paper. We had paper slips for prescriptions, for the delivery pickups, the delivery time. So everything was paper. Over time, a lot of things have been converted to paperless. And so that is why I encourage you, I challenge you to be consistent with using the software management system at your office. All right, y'all. So mistake number 4, it really does kind of sort of tie into mistake number 1, but mistake number 4 is going to be not making sure that it is a clinical person, a clinical assistant that is checking in the lab cases. So many times in different offices, they have made the mistake of having the front desk administrator who has little to no knowledge about the clinical aspect of dentistry, right? They are checking in the lab cases and they are putting the green light saying, okay, Miss Jones' case is here, Miss Johnson's case is here, Mr. Smith's case is here. And they do not even have the knowledge of, if they were to see the device or the item that we ordered from the lab, they wouldn't even know what it looked like or if it was correct. Is it the right shade? Did you order 2 crowns and in the case that was delivered, there's only 1 crown? And so it is very important to have the clinical department or the one assistant that should be assigned to the lab case management system, right? Checking those items. When they come in, you have to literally open these boxes, open these packages to make sure that you actually received what you placed on the prescription. Okay, so again, mistake number 4 is having an administrative or somebody else check in your lab cases. You have to make sure it is the clinical department checking in those lab cases. Number 5, let's get into it. Mistake number 5 is going to be not pulling your cases early enough. Meaning every case that you are about to deliver or you're about to try in, you should be pulling your cases at least 3 days prior to the appointment, okay? When the patient is en route to their dental appointment or in the waiting area, and God forbid they are in the chair, that is too late. That is absolutely not the time to be pulling your cases. Okay, so let me share a little quick story, little mistake, and I told you guys that's the purpose of this channel, is for me to be transparent and to share some of the things and mistakes that I have made in the past that I just do not want you to experience. And so we had a patient coming in to deliver her final crown. I seated her, I bibbed her, I took her crown off, her temporary crown that I made. It was so cute, but I took the temporary crown off. I cleaned the temporary cement off of the prep, and I was so excited, ready to go and call the doctor in, when I looked up and realized that I did not have her case in the treatment room. I instantly freaked out. And I just was like, oh my goodness, Ruby, let me pray that the lab case is in the closet. So y'all, I got up, went into the closet, shuffled through, and y'all, it was not there. It was not there. So the doctor was not happy with me. I was not happy with myself. The patient, thankfully, was so sweet, because what had to happen was I had to put her temporary crown back on with temporary cement, and she wasted her time. She wasted her gas. We wasted an appointment slot that could have been used for somebody else. And it was just I felt like at the time, the biggest mistake, but we got to turn those mistakes into lessons. And from there on, I made sure that all of the patients, if they were coming in on Friday, on Tuesday, I was making sure that their case was in the office. No questions asked, okay? Not that it was just in the office, but I looked at it, made sure it is exactly what we ordered. Okay, so again, a mistake is waiting too late to pull your lab cases. You have to make sure that you have what you need before the patient comes in for their appointment. Mistake number 6 is going to be having just a bad communication or a line of communication with the laboratory. And so, mind you, there are several laboratories that we're working with, but you should always have the lines of communication open. You should know what to expect when it comes to them, delivery times, and so on and so forth. And they should kind of know what to expect from you. And so in the case that there's questions, you should be able to call them, let them know, hey, my name is Ruby. I am the lab case manager here at ABC Dental. Just wanted you to know my phone number, my direct phone number, or my email is this, and this. If there's any questions with any of the cases, please let me know and I will gladly help you. So the whole idea is trying to make their job easier to make your job easier by keeping, again, the lines of communication open when it comes to laboratory communication. Mistake number 7 is going to be not having a schedule for your routine follow-ups. So, like I mentioned time and time again, there are different reasons why that second appointment falls off the books. Maybe they had a family emergency, forgot that they were on vacation for that appointment. Maybe the office had to close for whatever reason, right? So my point is there are times where that second follow-up appointment, that delivery appointment, that seat appointment is missed or having to be rescheduled or canceled. So you have to make sure you have a process or on your schedule a time to go into the lab closet or the lab space, where you're keeping everything, and making sure that the patients who did not receive their devices are called back. So you're calling them back, you're following up. Hey, Ms. Jones, remember we were supposed to see you last week for your crown, right? And you weren't able to see us. You had a family emergency. I'm calling you back to make sure that you get your crown seated. When can you come in? All right. Or, hey, Mr. Johnson, I'm so sorry to hear about your family emergency. I hope you're doing better. Is next week going to be a good time for you to come in on Wednesday at 2:00 to get your dentures delivered? Right? So that is what a follow-up appointment is, or having a schedule. And it is a mistake if you do not have a process for following up with those appointments that just get dropped or canceled or rescheduled, like I said. Because what will happen is you will turn around, if you do not have this process in place, you'll turn around and you will have a bunch of random lab cases that the patients has not came in for it to be seated, delivered, or, given to them. And that is, for one, it takes up space. It's a money waster, because a lot of the things that we're asking the lab to fabricate, like crowns, like bridges, over time, they will most likely not fit the same way. And so when they do finally come in, let's say it's 3, 4, 6 months later, the chances of that device or crown fitting is decreased. So a lot of times the crown basically all will not fit. And so it is so important for us to remember to schedule those follow-up appointments. And if they do fall off, which naturally I promise you that it will, but if you have in place a time on your calendar every 2 weeks, every 3 weeks to call these patients back, you will be just fine, and it will help you decrease with all of that extra lab cases that you have that patients has not came back in for. All right, we're down to number 8. This is the final mistake that I want to talk about today. And that final mistake is going to be not having a designated area for your lab cases. So it is super important for you to just be organized. It just makes our dental assistant life so much easier when we stay organized. So basically, you guys, you should have an area, a designated space for lab cases that we are sending out. So pretty much when you turn around at the end of the day, you can see that that space is empty, or the mailman or mailwoman has came and you have sent that lab case out. And then you should have a designated space for when you're checking lab cases in. Okay, you do not want to have lab cases that's supposed to be going out, lab cases that are coming in just mixed all together. It causes confusion and chaos, and that is not the type of dental assistant life we are wanting to sign up for. Okay, and so I hope that you listened very closely to these 8 mistakes that you can avoid. You can avoid them by listening to this video, and not just listening to it, you guys. I need you to actually apply all of these tips and skills and advice that I am trying to share with you so that you can avoid, like I said, some of the mistakes that I have made. So I hope this video serves you well. Please, in the comment section, ask me questions, concerns, or any video requests. I would love to create videos for you. And again, thank you so much for tuning in.